Oyo State Health Insurance Scheme was officially flagged off on the 25th of May 2017. The scheme, tagged OISHA, was designed to provide financial risk protection against huge medical bills, reduce out-of-pocket expenditure on healthcare, improve access to quality healthcare services for the residents of the state, and to provide solidarity between the sick and the healthy, rich and poor, employed and unemployed, young and the aged, as part of strategies for attaining universal health coverage in the state. The Oyo State Health Insurance Agency, OISHA, offers a variety of health insurance plans for individuals, families, businesses, and more. Other plans include Standard Peak Plan, Pregnancy Plan, Community-Based Health Insurance, Student Plan, and Staff Benefit Package. OISHA's goal is to provide affordable and quality health care to all citizens of Oyo State.
OISHA, Oyo State Health Insurance Agency.
And now, OISHA has come up with another package. This time, it is the enrollment of about 10,000 vulnerable children in public primary schools into the state's health insurance scheme under the Oyo State Health Insurance Agency, OISHA. This gathering is the symbolic flag-off of the Public Primary Pupils Health Insurance Scheme at the Ibadan Civic Center, Idiakme, in Ibadan, the state capital. OISHA's Executive Secretary, Dr. Olushola Akande, described the scheme as the first of its kind in Nigeria, noting that it is the 9th door created by OISHA towards ensuring quality health care delivery to residents of the state on the watch of Governor Makinde. He also commended UNICEF for giving OISHA the logistic support towards reaching communities and improving its awareness campaign, among others.
Providing access to quality of healthcare, the agency, through payment of application to various accredited hospitals, has contributed significantly to the efforts of Oyo State government in repositioning our hospitals for better service delivery, especially at the primary health level. It interests Your Excellency to note that Oyo State Health Insurance paid up to 735 million 366,023 call as capitation to all our accredited hospitals in 2024 alone.
Other speakers also lauded the efforts of Oyo State government at ensuring that quality healthcare gets to every individual at a minimized rate.
I want to use this opportunity to appreciate His Excellency the Governor of the state and to also thank the agency for considering it worthy to extend this program to our public primary schools. I, on behalf of Oyo State Universal Basic Education Board, the parents of our pupils, as well as our teachers that have been taking care of these pupils in our various public primary schools, want to say a very big thank you to the agency, by extension to the government of Oyo State.
Health is wealth. The first wealth we can get is our health. And you all know that for a child to remain in class and be successful, that child needs to be healthy. Education is the cornerstone of society, so also a child, a healthy child, will be a successful learner. And now the scheme that we are flagging up today is going to remove the barrier that our teachers face and even some parents in accessing care at our facilities.
I really love the initiative because it really helps the pupils in public primary schools whose parents are not can't afford to take their children to the hospital for health, and it will really help them in taking care of their children's health.
I want to thank the governor for everything you have done, Engineer Shemakinde. Thank you. If I can go to the hospital, nothing will happen. They will give me free charge. They will not collect money. May God bless you in the mighty name. May you live long and spend the mighty name of God. Thank you. I am very happy for the program today, what the governor has done.
In her goodwill message, The Chief of UNICEF Lagos Field Office, Ms. Celine Lafoucriere, noted that the launch of the Oyo State Public Primary School Pupils Health Insurance Scheme will ensure access to affordable, quality health care, which is a fundamental right of every child. She commended the Oyo State government for being a trailblazer on such a scheme.
UNICEF plays a key role in ensuring that we support Oyo State with ensuring that we generate demand for this healthcare scheme. As you know, there's very little awareness in the state. The parents do not know sometimes of the value of a healthcare scheme, sometimes the existence of a healthcare scheme. So we are playing a key role in supporting the Oyo State in doing that.
Governor Seyi Makinde, who was represented by the Deputy Governor, Barrister Abdurrahim Bayolawal, presented the health insurance identity cards to beneficiaries.
Linda Ijen Ibrahim Ogolaji, okay?
According to the governor, the enrollment of the public primary school pupils into the state's health insurance was a well-thought-out policy aimed at securing the future of the children by ensuring that they get an all-round education with healthy bodies and sound minds.
A sound mind is always in a sound body. And that captures the essence of today's program. We want all our children to have sound mind. And as the Commission for Health indicated, without good health, you cannot have sound mind.
The 10,000 pupils drawn from 90 schools across 18 of the 33 local government areas of the state can now access quality healthcare without paying exorbitantly for it. For such a feat as this, the Oyo State government, under the leadership of a pragmatic leader, Engineer Oluseyi Makinde, deserves to be commended.
You hustle and struggle to make a living, yet the evil one in some people could suddenly crush your dream and make you vulnerable. But hold on, someone somewhere could be saying something and will say something. Be your brother's keeper. If you see something, say something. The security of life and property is a collective responsibility. If you see something, say something by calling 615 and the emergency response team will be there.
Or call 090 7449 1249 or visit Oyo State Crime Alert platform.
The Oyo State Governor, His Excellency Engineer Seyi Makinde, says a big thank you for your support to keeping the Bayelsa State safe.
110 kilometers Rashidi Ladoja Circular Road in Ibadan is a major road project designed to create a bypass for travelers and freight commuting through the city, reducing traffic congestion and opening up new areas for development. The project has suffered incurable damage of handling over the past 29 years of its conception and approval by a military head of state. While the military governments were on it for 4 years, civilian administrations have been on it for 25 years without success. Governor Seyi Makinde, however, became the executor of the all-important project, which aims to reduce traffic congestion in Ibadan metropolis, as well as boost industrialization in the state. The project involves 4 sections: southeast 32.2 kilometers, northeast 34 kilometers, northwest 23 kilometers, and southwest 20.8 kilometers. The first phase, including the 32.2 kilometers east wing and the 36.7 kilometers northeast wing, is planned for completion.
The most important thing from this circular road is connecting Lagos to Ife faster than passing through Ibadan city. because of the traffic at Ibadan city. This circular road is going to make the movement easier and is going to decrease the traffic at Ibadan.
At some point, concerns about setbacks affecting the circular road project became an issue. Affected residents staged a 4-day protest at the governor's office, Agodi Secretariat, demanding the cancellation of the Ibadan circular road corridor, citing a government-imposed setback for 500 meters that would lead to significant demolitions and notices on their properties. Addressing the protesters, Governor Makinde praised them for their peaceful demonstration, emphasizing the importance of maintaining public order. He clarified that, contrary to various speculations, the circular road project during the late Lam additional regime had planned a 75-meter setback on either side, totaling 150 meters. Makinde explained that subsequent administrations, including those of Rashidi Ladoja in 2006 and late Senator Abiola Ajimobi in 2018, had expanded the setback to 500 meters, a plan his administration is currently implementing without any alterations. He then promised to work along with the people to ensure those affected will be duly compensated.
What they said to me is, look, we want the circular road, but we don't want the corridor. And I said, yes, we must plan. The corridor that they're talking about, 500 meters to the right, 500 meters to the left, this administration did not bring that on board. It was the previous administration. However, I told them they must remain law-abiding. That's one. And then two, anyone that has a building standing outside of the initial 150 meters, those people will be integrated. We won't demolish any of the buildings outside of the 150 meters that are already existing. But from now forward, don't start laying your foundation within the corridor.
The governor, in keeping to his promise, set up a monitoring team headed by the Executive Assistant on Security, Sunday Odukoya, to come up with a workable compensation plan using the existing table. The committee commenced work immediately. A verification exercise was done, where the affected persons had to produce required documents to substantiate their claims to avoid duplicity. That done successfully, the report was submitted to His Excellency, Governor Seyi Makinde, and true to his word, payment is ready to be made to the affected persons who fall within the first tranche of compensation payment, beginning from Ajota to Alago under Segment 1 of the project. The affected persons are here at the Ministry of Lands and Housing. The Commissioner for Lands and Housing, Mr. Williams Akinfumilayo, said the state government has begun the payment of over 264 million naira to the first set of people affected by the project, noting that others would also be called upon soon as the payment is being made in tranches. This was as the Commissioner assured that the government has also worked on compensation for property owners affected by the ongoing constructions of way bridges on Iseyin-Fapote-Ogbomosho Road and the intersection on Ibadan-Ife-Ajia Airport Road with a spur to Amuloko.
In this exercise, 3 sets of compensations are coming up. The very first one, like I said, it's those whose buildings and structures were affected in the first segment of the circular road. But it's only part of them, not all those that are affected are being considered now. It's only some of those that are affected. And the governor has already released a sum of over 250 million. To be precise, it's 264 million naira has been released for payment to those that are affected. In this same exercise, we are going to pay out to those who construction of overhead bridge at Ajia. This construction of overhead bridge at Ajia, whose buildings were affected as a result of the construction of that overhead bridge. As well, a sum of 53,367,000 naira is going to be paid out to those whose buildings are affected.
Similarly, Executive Assistant on Security to Governor Makinde, CP Sunday Odukoya retired, who is also the chairman of the Monitoring Committee on Compensation for Affected Landowners in Ajota to Alago axis of Ibadan Circular Road, commended the governor for paying compensation to the affected property owners after his committee had carried out a thorough verification exercise. He, however, warned residents to do due diligence before embarking on land purchase to avoid situations such as this.
Anything government wants to do for them, they should take it serious. Nonchalant attitude of most of our people to be compensated causes a lot of hardship to most of them, because before development takes place in a particular place, government will have informed them that this is the project that is coming up, but they will not believe. And anybody that is trying to buy land should ensure that it comes to either of your general service or lands office to check the master plan of that particular area so that it doesn't fall into the wrong hand.
In their separate responses, some of the beneficiaries hailed Governor Makinde for keeping to his word that compensation would be paid to affected property owners.
If not Governor Makinde as somebody that has human feelings, so many governments have been passed. They used to make promises, but they will not fulfill it. But thank God that God Almighty has given us Makinde, that when he make a promise, he try to fulfill the promises.
Makinde and his entourage, they have made me happy, and I was very happy today that he promised us that he's going to give us something, and he has fulfilled the promise.
The
beautiful part of this project, which is being constructed under a build, operate and transfer BOT arrangement, is that the construction of the 32-kilometer East Wing section of the Circular Road is at no cost to Oyo State government. The Ibadan Circular Road project indeed is one of the most direct and simple projects to give better life to the people of a mega city and a state.